A tongue tie is where the frenulum, or the little band of tissue between the tongue and the floor of the mouth, is short and doesn't allow the tongue to move as well as it should, and this can affect breastfeeding. Tongue ties are not very common. We see them more as a lactation consultant because we see the babies who are having trouble, but generally we'd say it's between sort of 7 to 10% of the population that might have a tongue tie. And signs that you might know that your baby is tongue-tied would be painful breastfeeding that doesn't resolve in the first few days, babies who are disorganized when they're going to breast, just can't seem to keep that latch or figure out how to get a good latch, if they stay on with a shallow latch, or babies that are tired, that they feed fairly well but they just get tired before they're full. That would be another reason I would be looking at, is their tongue working correctly? And with that, it's really important to not only think about correcting the tongue tie, but looking at the whole baby and seeing, do we need to involve somebody like an osteo or chiro to help loosen up that baby, and then we can address the tongue tie surgically if that's necessary. So if your baby has a tongue tie, or you suspect that your baby has a tongue tie, it is really important to find somebody who can assess the function of that baby's suck and the way they're feeding. It's not just about looking at the little membrane or that frenulum and deciding if it's too tight. We want to see how their tongue is working. So a lactation consultant with experience with working with babies with tongue ties would be your first line of the person you need to see, and then they can make the necessary referrals in the community for some chiro, some osteo to help the baby loosen up, and then referrals to either a physician who can do the release or a dentist who can do the release. So there are different options. And then it is really important to work with somebody, again, most likely your lactation consultant, who can work with you doing exercises and helping to retrain and making sure that that baby is able to suck effectively after the release.